All right, welcome back. Here we are for another set of practice questions for your Step 2 CK. I am Shelf. I am Comat. As always, please like and subscribe, and let's jump into it. So here we have a 40-year-old woman who presents to a primary care physician with complaints of persistent dry cough, shortness of breath, and generalized fatigue for the past 4 weeks. Now, before I continue reading, go ahead and pause it, answer it for yourself, and then we'll finish and go to the answers. So this woman, she denies any fever, chest pain, or hemoptysis. Her vital signs are within normal limits. Her medical history is unremarkable, and she is not taking any medications. She is a lifelong non-smoker. Physical exam reveals bilateral hilar lymphadenopathy. A chest x-ray shows bilateral lymphadenopathy without infiltrates. Pulmonary function tests indicate decreased lung volumes and impaired gas exchange, and it's asking what is the best next step for this patient. So I hope when you see this question and you see the female with the dry cough, shortness of breath, and these generalized symptoms, she doesn't have any fever, chest pain, or bloody cough, and then this really big part, bilateral hilar lymphadenopathy. I hope when you see this presentation, you're thinking of sarcoidosis. And I'll go ahead and highlight some of those key details for sarcoidosis. And so with that in mind, you're thinking what's the best next step, you got to realize where we are in the question, because the question here is asking what's the best next step in management. So we haven't confirmed the diagnosis, even though we know the patient has this presentation. That's what makes answer choice A incorrect, administering oral corticosteroids. While corticosteroids are the treatment option for sarcoidosis, they typically are started after confirming the diagnosis, and they're not part of the initial step. Now going to option B, performing bronchoscopy with bronchoalveolar lavage. This procedure may be used in the evaluation of sarcoidosis, but it is usually reserved for cases where the diagnosis remains unclear after initial assessment. It's an invasive procedure, and it's not the first-line step in the evaluation of suspected sarcoidosis. So we're not really thinking that either. And there's no evidence of infection in this question. They said that she has no fever, no chest pain, no hemoptysis, so there's nothing really to indicate infection in which we'd want to start antibiotics. The same could go for obtaining a sputum culture, because knowing it's not infectious, there's really no reason to obtain a sputum culture. So that leaves us with the last answer choice. Answer D. Order a serum angiotensin converting enzyme level. And this is something you have to memorize for sarcoidosis, is that your ACE level is going to be elevated. It's a typical marker that's used for sarcoidosis. When you have someone who presents with dry cough, shortness of breath, and generalized fatigue, and that bilateral hilar lymphadenopathy that's suggesting sarcoidosis, you really want to be considering ACE as a possible answer choice. Another good answer choice would be chest x-ray, and that would be to look for the bilateral hilar lymphadenopathy if they hadn't given it to us and they were still strongly suggesting sarcoidosis. I just wanted to show you a quick picture of what those bilateral hilar lymphadenopathy looks like. Here you can see these little nodules on the outside of the trachea, just both sides bilaterally. If they give you this x-ray, or maybe they're asking for what x-ray or imaging you would do next, so you'd want to do x-ray to look for this, but this presentation, or this bilateral hilar lymphadenopathy with the dry cough, the female, the fatigue, and the other vague symptoms are what would point you to sarcoidosis. There you have it. Please like and subscribe. I'll see you in the next one.